Now, a new report by a left-leaning think tank has said a tax on sugary food and sweets could save the NHS billions of pounds and help prevent more people dying from coronavirus. The Institute for Public Policy Research has called on the government to go further than current obesity crackdowns and extend its sugar tax to unhealthy foods instead of just fizzy drinks in the fight against obesity and indeed also COVID-19. Well, Dr. Ashley Malhotra is a leading NHS-trained cardiology consultant, also the author of the book, The 21-Day Immunity Plan, who joins us now. Doctor, thanks ever so much for your time today. Tell us about this book, The 21-Day Immunity Plan.
Sorry, I missed that.
Sorry, just tell us about this book. It's The 21-Day Immunity Plan.
Yeah, Colin. So I've written this book. It's just published today. Thank you for mentioning it. And basically, the message of the book is that we know that poor metabolic health, which essentially is conditions related to excess body fat, even people with a so-called normal body weight, body mass index, is linked to poor immune health. And from my own analysis of the research, from clinical studies, from my own experience with patients, the good news is through lifestyle changes, you can rapidly improve these risk factors, if you like, associated with many of these conditions, but also very likely help support normal immune function and reduce the risk of complications from viruses such as COVID-19, but many sorts of infections. So I think one of the messages that I'm trying to convey through the book is that if people start now, within a few weeks they can notice significant changes in their health markers, they'll feel better, they'll be happier, and it's very likely they'll have a more robust immune system, all related to the kind of foods people are eating, the amount of exercise they're doing, their stress, and their sleep. And of course, the book was originally triggered by the fact that, as you probably know, Colin, I was the first person to publicly highlight the links between the Prime Minister Boris Johnson getting very sick from COVID-19 being related to his weight, his excess weight. And it's good to know that, see the Prime Minister is taking some initiative on this now. But I think the one thing that I think is really important for people to get across, for people to understand, is that the real driving force, the big factor behind all of this is our consumption in this country of ultra-processed food, which is more than half of the calorie consumption in our diet. And if we take that out, if we go cold turkey even for a few weeks, people will see significant changes to their health, their hunger will reduce, and this is what we should be tackling. And the report from the IPPR, I do welcome it today, because taxation of ultra-processed food will reduce their consumption, use that money to subsidize healthier foods, would have a big impact on population health. And we know that will work because it worked with us tackling big tobacco. The biggest decline in cigarette consumption over the last few decades happened because of taxation of cigarettes.
Just if we could stick just on COVID specifically, I mean, that data yesterday, didn't we, showing the correlation between obesity and people who were succumbing to COVID. So that link is becoming more and more emphatic all the while. I just wonder whether people have sufficient time to seriously change their metabolism to the extent required to improve their immunity in the face of COVID. You're saying they can?
Colin, I mean, I have these conversations with patients all the time, and people from all different socioeconomic backgrounds. And I think the first thing I tell them to do, which actually, doesn't take any time in a way, it's about, it's just as important what we shouldn't be eating as what we should be. But what I tell them to do is anything that comes out of a packet that has 5 or more ingredients, usually with additives and preservatives, is ultra processed, and just avoid it. And if they just do that from the beginning, then people find their cravings for these sorts of sugary and starchy foods tends to disappear after a few weeks. So they break that addiction, if you like, and then emphasize just whole foods. I think it's a relevant point you raise about time. I think when we think about things like basic cooking skills and people spending time cooking, that is more time consuming. But people there are options out there. We obviously want to encourage the food industry and other food retailers to produce more whole foods and minimally processed foods, which are already prepared, which people can eat very quickly. They can eat without having to prepare themselves. So I think this is very viable. And I think one of the messages I get across in the book with the background science is it helps people understand actually how quickly and how impactful these changes can be in a very short space of time. And then when people go through this process, Colin, I see with my patients, they're amazed. They come back after a few weeks. They can't believe how much better they feel. And when I do measurements on things like blood pressure and their blood glucose or whatever, even their waist circumference, they're significantly better, then that motivates them to carry on. But I think what I should emphasize is that this is one part of the equation in solving the epidemic of obesity and related diseases, because we really need government regulation to improve the food environment, because it becomes almost impossible, Colin, to avoid these sorts of foods everywhere you go. Even our hospitals, 75% of food purchased in hospitals are unhealthy, and more than 50% of NHS doctors and nurses are overweight or obese as well, because the main driver is the food environment. So it needs government action as well as people taking individual responsibility.
Dr. Malhotra, appreciate your time. Good luck with the book.